Hello, everyone. Today we're going to be talking more about managing menopausal symptoms, and we're going to be diving into hormone therapy, what it is, how it works, why it's safer than many people think when it's done right. I'm Dr. Lola Ashaye. I'm a family medicine and lifestyle medicine physician with special training in menopause care, and I'm the founder of InTouch Primary Care in Sugar Land, Texas. So welcome to Connecting the Dots. So if you're joining us for the first time, last week we talked about ways to manage menopause symptoms. And like I said earlier, today we're going to talk more about hormone therapy in specifically. We talked about non-hormonal options last week. So you can go back and listen to that. Also, if you haven't already, I encourage you to subscribe. Share this with someone in your life that might need it. And if you're in the Houston area and you're experiencing symptoms and you're ready to feel better, you can schedule an appointment with us. Okay, so I'm going to kind of break it down into 4 different sections. The first section, we're just going to talk about what is hormone therapy. So hormone therapy, some people call it HRT, is a treatment that replaces hormones in the body because the body naturally stops producing hormones or reduces the production of certain hormones during menopause. And these hormones are mainly estrogen, progesterone, and sometimes testosterone. So testosterone actually declines due to it's age related. It's not necessarily just due to menopause, but these hormones are affected. All these hormones can be affected during that time period. So with hormone replacement therapy, the idea is to try to do 2 things. Number 1 is to help with symptoms for those that may have symptoms due to the decline in the hormone levels. So symptoms like hot flashes, night sweats, brain fog, vaginal dryness, and many more symptoms: joint pain, frozen shoulder, palpitations, anxiety, depression. There's a long list of things that people can experience due to the hormonal decline. But there's another reason that hormone replacement therapy can be helpful, and that's to support long-term health because it does support the bone and the heart. So, who is this for? Well, again, it's generally safe and effective for most healthy women, especially within the first 10 years of menopause. It can be used beyond that, but majority of women will find maximum benefit when it's used within the first 10 years of menopause. And it's especially helpful for symptoms like hot flashes, night sweats, vaginal dryness, sleep mood disturbances, joint bone loss, osteoporosis, or how a lot of people describe just not feeling like themselves. Replacing hormones can be really helpful in those scenarios. Now, what are these hormones and what are they used for? Well, first one I'll talk about is estrogen. It's the main hormone. It helps with hot flashes, it helps with sleep, vaginal symptoms, it helps with bone health. The other one we typically use is progesterone, which has to be added if you still have a uterus. So if you still have a uterus, you're going to need 2 automatically. You're going to need estrogen and you're going to need progesterone. And that's to protect the lining of the uterus. But it too, a lot of women find that it helps them sleep better, it helps them feel more relaxed. And so some people without a uterus take progesterone as well. And in some cases, testosterone needs to be added. And as I mentioned earlier, that's not a function of menopause per se, but there's a natural age decline, natural decline in testosterone as people get older. And so sometimes testosterone is needed, especially for people struggling with low libido or low energy. So hormones come in many different forms. They're pills, they're patches, they're gels, they're sprays, they're rings, they're creams. So there has to be a discussion about what works best for each person. So what to expect? So in terms of safety, which is something that comes up, I prefer to do stepwise and monitor closely. It does take time. It could take 3 to 6 months for the body to adjust and for people to see significant effects. So I recommend close follow-up and a stepwise addition of hormones. Some people will have side effects with these hormones. Some people might have breast tenderness or vaginal spotting. A lot of side effects are temporary. Obviously, we are most worried about more serious side effects like the increased risk for blood clots, for instance. And these need to be discussed, and benefit versus risks always need to be discussed with the patient, but oftentimes the benefits far outweigh the risk for many people. So there are also risks for not treating, and that's something I talk to with my patients. So some people, would really, really benefit from being treated for various reasons. And when you do not treat menopausal symptoms, it can significantly impact health. It can significantly impact life. It can even significantly impact relationships. So it is important that the symptoms are treated and that we're thinking about long-term health, and it could be used as for preventative measures as well. So just wanted to mention hormone therapy is not just about turning back time or becoming younger. That's not what it's about. It's really about helping people feel strong, feel clear, feel comfortable in their body, and just feel better overall. So I hope that helps. We're going to talk more about how to build a personalized plan for people that require treatment. And don't forget to subscribe, share this with a friend. And if you're in the Houston area, you can go ahead and schedule a consultation if you need further assistance. I hope that helps.